This is the case of coarctation of aorta. This is parasternal south axis view. You can see the left ventricle enlarged and global hypokinesia, though mild degree. Now this is bicuspid aortic valve. You can easily identify this is bicuspid aortic valve. And you can see eccentric aortic resistance jet. This is jet here. This is eccentric. You can see the gradient. Gradient is very high here, almost 87 millimeter mercury across this descending aorta. Again, the same thing. Now I want to show another video from the same case. You can see this. See the actual gradient. This is 109 millimeter mercury. Same patient. Again, you can see the actual gradient very high. You can see this is suprasteroid long axis view. This is arch, and this is left subclavian, left common carotid, and after left subclavian, you can see the narrowing. This narrowing is coarctation of aorta. You can see the gradient. Gradient is very high. The same patient. You can see here the very interesting image. Very interesting image. This portion here is the actual narrowing of descending aorta. You can see this post-ductal coarctation, that is most common variety. You can see the turbulence of color here. Here you can see the narrowing. You can see here, this is the place where you will find narrowing of the descending aorta. Obviously, postductal coarctation means after the left subclavian, you will find this coarctation. Same thing. This is the place. This here the place is. So initially, I could not get the diagnosis. Patient was having bicuspid aortic valve, mild left ventricular systolic dysfunction, severe eccentric aortic regurgitation. But later, when I performed examination of renal artery examination, because patient was having lots of hypertensive medication, at BP was not controlled, then I found the blood velocity is quite slow in renal artery. Then I thought something must be there, because hypertensive patient very low velocity in renal artery. Then I thought some sort of coarctation. Then examined properly, and then I got this coarctation of aorta. So initially I also missed because blood pressure was not taken in both upper and lower limb. So patient was not that much old, only 35 approximately, 35 years of old age. So whenever you find a hypertension not getting easily controlled with 3 or 4 drugs, in that case, what one should do, one should take blood pressure both in upper limb and lower limb. If there is difference, then coarctation is likely finding. In this case, I got this finding because I performed renal artery Doppler. There I found very low velocity in renal artery. Both sides almost same thing, very low velocity. That made me to find out coarctation of aorta, and then I got. Initially, I had already missed. You can see this highly turbulent yellow shiny area. You see this shiny area. This is the actual part where the coarctation is located. So if you take blood pressure both in upper and lower limb, especially whenever you you are getting a case that is not, their blood pressure is not easily controlled, then coarctation will not be easily missed. At the same time, you have to be, as a part is very narrow, very small in size, so you have to localize, you have to focus on the area when you are performing continuous wave Doppler, a spectral Doppler of continuous wave. So that should be the point to understand in this case. Again, see. So here you have to place this continuous line along this. This is the part where the coarctation aorta is. See, the gradient is very high. You can see the gradient 124. So this lining should be proper, otherwise we will miss the case. So I have seen the bicuspid aortic valve severe aort. I looked the aortic arch in suprasternal view. I missed initially because this continuous line was not properly aligned, and that because very narrow part, so line must be aligned to this narrow part. So I missed initially. Later on I found, because I performed renal artery Doppler for the same, BP was not easily controlled in that case. Then I got this point, very low velocity in renal artery, in both renal artery. And then I suspected coarctation aorta, and I finally got it. Thank you.